Good evening, everybody, and welcome to our Medicare 101 webinar. In a moment, I'm going to introduce Tamme Nash, who's our featured speaker for the evening. I'm Mike Hebern, the Chief Operating Officer here with Level Financial. And we welcome everybody who took their time out on their Wednesday night to get educated on Medicare. So just a couple of ground rules about the webinar. First, if you have a question, we want it to be interactive. So please feel free to use the chat function on the webinar window to ask questions, and we will interrupt at appropriate times during the presentation to interject and get Tammy's answers to your questions. Secondly, if you're thinking that you might want to talk to Tamme offline separately, we're offering our text feature for everybody on the webinar. You can text the word Medicare to 716-727-5047. We'll have that on a slide later on in the presentation. And if you text that word to that text line, you'll get an automatic response. And then we will have Tamme reach out to you directly, within the next 24 hours or so to answer your questions. So with that said, I'm going to introduce Tamme. So Tamme Nash is the Vice President with the Sable Insurance Agency, and she is officially an Insurance Benefits Coordinator, where she's worked for over 20 years, specializing in the Medicare industry. In her role, she helps seniors and those turning 65 and disabled clients understand what to expect when becoming Medicare eligible, along with the various costs, the difference in health and prescription plans available. Tamme lives locally here in Amherst with her husband, 4 kids, and 3 dogs. So she has her hands full. And a fun fact about Tamme, other than that she is an absolute pleasure to work with, is that when she's not working or enjoying time with her family, she loves photography and always has a camera in hand to capture special moments, sunsets, and nature. So I'm going to ask Tamme, go ahead and turn your camera on, and I will get you unmuted here. And while we're doing that, I'm also going to go through our important disclosure information. So let's see if I can unmute you here, Tamme. Try that. You might have to unmute yourself, Tamme. Let's see.
Okay, hello.
There she goes. Okay, good, perfect. Okay, so there's Tamme. And before Tamme gets started on all her great information, we're going to talk about a couple of important disclosures that we have to do based on our government requirements. So Tamme, if you could just advance that a little bit so I can see.
I'm trying. Unfortunately, it's not letting me advance it. Let me try.
Arrow down. There you go.
Yeah,
click on it.
It's stuck.
Okay.
I apologize.
That's okay. That's okay.
Let me do it.
Okay, perfect. So Tamme, I'm going to come down there real quick, and we're just going to fix that while you can ad lib while I come down, and we'll get that taken care of for you. All right.
All right. I definitely wear the black cloud of computer over my head. That's why I thank God Mike is here. And hopefully this will be fixed in just a moment.
All right.
It won't.
Okay.
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 So you touch the pad. Okay. Got it.
Okay.
Yep, we got it. All right. And Mike will be back in just a minute to go over the important disclosures. And I look forward to talking with all of you tonight. Thank you so much for having me.
Tamme and I are not virtual. Tamme is actually in another room right down the hallway. So I did my best sprint job to get down there and fix the technical issue. So just quickly for everybody, our disclosures here is that Level is not a law firm nor an accounting firm, and nothing that we provide today should be construed as legal or accounting advice. Moreover, you should assume that any discussion or information contained in the presentation serves as a receipt of or as a substitute for personalized investment advice from Level Financial. And of course, past performance may not be indicative of future results. So those are our disclosures. Tamme, I'm going to shoot it over to you now and let you begin the presentation. And And I will mute my microphone.
All right. Well, welcome everybody. I'm so glad that you're all here to join us, like Mike said, on this Wednesday night with no rain. So we at least got a sunny Wednesday. And, we're going to talk very, very basic Medicare facts tonight, things that I have put together that are usually the most important questions or concerns, or just the most important things to know about Medicare when you're approaching 65 or might be disabled. All the most important questions that a lot of people ask are pretty much formulated into this presentation tonight. So I'm going to go through it. Like Mike said, if there is any questions that you may have throughout the presentation, please feel free to put them in the chat and he will let me know and we can answer them along the way. Or if you feel uncomfortable and you want to talk more privately at a different time, you can also use that texting feature. So we're going to start with what is Medicare. Medicare is a health insurance for entitled beneficiaries, either 65 years of age or older, under 65 with certain disabilities, and any stage of individuals with end-stage renal disease or diagnosed with ALS. The administration of CMS stands for Centers for Medicare and Medicaid Services. So a lot of times I get these calls or people want to talk or inquire during certain enrollment periods in their lifetime. And in a nutshell, this slide discusses enrollment periods at a glance, the actual enrollment periods that would pertain to an individual in different phases of their lifetime, depending on their scenarios and situations. And basically the first bullet point here that you see is the initial enrollment period, which is what we abbreviate as IEP. And that usually happens 3 months before somebody's 65th birthday, the month of, or 3 months after someone's turning 65. So when somebody's approaching 65, there is what we call that initial enrollment period that is a 7-month window that allows somebody to enroll in Medicare if it is appropriate for that individual. And there's a lot of different reasons why somebody may or may not, which we'll get into as we go further into the presentation. For people that may have missed their initial election period, they can also go and enroll during other times of the year, which is what we consider the general enrollment period, or GEP abbreviated. That time frame will take place during the first of the year, which is January 1st through March 31st of every year. But when people apply during their general enrollment period, a lot of them assume that they're going to be effective then April 1st, but that's not the case. It will run through and start July 1st of that same year. So even though you're applying in your general enrollment period in January, you will not have Medicare begin until July. Unfortunately, when you miss your initial election period and you have to sign up during the general time, you will be subject to a penalty at that point, depending on how many years it's been that you went without Medicare. And that penalty that can apply is 10% for every year you don't take Medicare, and that is forever. So if you miss it, your initial election period, and then you sign up in your general enrollment, that year you'll have a 10% penalty on top of the average premium of Medicare, which we will get to towards the middle of the presentation. And that never goes away. That stays on, on your Social Security record for the rest of your life. The special enrollment periods, or another term for that, is SEP, which I do see a lot in my career in the last 4 years, I would say. A lot of people use these special enrollment periods. And the people that may fall into that category are people that are working and covered by large group employer coverage or covered by a working spouse. Key word here is large. And large in Social Security is considered 20 or more employees in that business, in that group, okay? So working and covered by a large group employer plan will allow somebody to wait to take their Medicare in their initial election period. And then when they're ready, they can sign up, which is considered the special enrollment period. In that time frame, they will not be subject to a penalty, because they will show proof when they apply for Medicare that they were working or covered under a working spouse during that time period. Medicare Part B, then, when you do go retired, they do allow you 8 months to apply for Medicare. So there is a window that if you or your spouse was to go retired, you're given an 8-month period to sign up with for B without a penalty. But most people with pre-planning, if that's possible for most individuals, they don't wait 8 months, and that's been my experience. But you do have 8 months legally. But the Part D, as in David, for the drug plan, they will only give you 63 days from that entire retirement date to sign up for a drug plan. That 63-day window, we will talk about as we go further into the presentation, but that would only apply to somebody if they've already enrolled in Medicare Part A. Lots of stuff. Can be a little confusing, but we always try to really, when we sit down with families or individuals, make it very, very beneficial and understanding due to their circumstances. But these are the general 3 times and 3 enrollment periods that people fall underneath. Okay, enrolling in Medicare. So in easier times, pre-COVID, the enrollment in Medicare was definitely very different. You could very easily, it says in here, set up an appointment and go down there if you did want to meet with somebody in person. At this point, due to the fact that the offices are still closed, they are working, the individuals are still working, but they are closed for people to walk in and set up an appointment unless it's an extreme circumstance. The best 2 ways to sign up for your Medicare are either to call Social Security, as you see on here with that number, to set up that phone interview to apply, keeping in mind that that can take 2 to 3 months at this point to get that appointment to sign up. So making sure that your time frame of planning that retirement and planning when you want Medicare Part B to start, you're thinking about those times, that how long it could take to set up that interview. Or for people that are in their initial election period, brand new to Medicare, in that 7 months, the easiest way is to go on through socialsecurity.gov. Why would somebody delay enrolling in Part A? So there's all different parts as we get into this presentation of Medicare. There's the Part A, there's the Part B, the Part C, and the Part D. Some people, when they're turning 65 and they're still working, they may be still working for a large group, and they're in what we call a high health savings account, a high deductible plan. And if somebody participates in that high deductible plan, you are allowed to contribute to that health savings account. So if your group is over 20 employees and you really like your health savings account, we advise you are not to enroll in Part B, even though you're entitled to Part A, even though you're entitled to it, because you cannot contribute to an HSA and also take Part A and Part B of Medicare. Medicare and your HSA. So just a couple little things about that, because HSAs have become very, very popular in our world of, group insurance. For the individuals that want to, definitely go into Medicare, you must cease that HSA contribution once you're enrolled in Part A and or A or B. If you enroll in Medicare after your initial election period, so past that 6-month window or 7-month window, and then you decide in a year or so you're going to retire and you're still contributing to the HSA, we advise that you stop contributing to that HSA 6 months before you enroll in Medicare. Any contributions made after enrollment are not tax deductible and may be subject to a tax penalty. You may continue to spend down all your existing HSA funds for qualified medical expenses. So even though that you are supposed to stop that contribution, if you do have quite a bit of money in that fund, that doesn't mean it disappears because you stop contributing. That money is always there for you to use, and it, obviously for medical expenses. If enrolling in Medicare mid-year, your contribution limit will be reduced by the number of months out of the year you are enrolled in Medicare. Enrolling in Medicare continued. So why would somebody delay enrolling in Part B? And this is probably the most important thing that we really try to get through people when they're, turning 65, because at this time of the year, when people are turning 65, and at any time of the year, you are being solicited and inundated like crazy with tons of programs. Everybody knows, it's your birth month. Everybody wants to talk to you. So a lot of people get really confused on what they're supposed to do. So this little bullet point here is, once again, why would I delay enrolling in Part B? Is if you will continue to work for your company after age 65 and you have health insurance through that employer or your spouse, you will not have to enroll in B. This is as long as that employer group is larger than 20 employees. Most Medicare eligibles will want to wait to enroll in Part B because there is an extra premium to take Part B of Medicare. Once again, as long as you're not continuing to contribute to an HSA, it never hurts you to take Part A. You're entitled to it. It's hospitalization and it comes at no cost as long as you've paid into FICA, at least 10 years or 40 quarters. But for people that are still working and they're in large group, why would you take B if you're going to have to pay for B and group insurance? If you are still working and your employer has less than 20 employees, it is advised to take Medicare Part B when you're eligible. If you do not take Part B when eligible, then you will be subject to a 10% penalty per year. So in my career, I've seen this many of times where individuals own a small business being under 20 employees, and they're happy with their group insurance. They're not planning on retiring in the near future. And they question, why would I take Medicare? I don't need it. But there is this rule, and this golden rule has never changed, that if you're still working, you can work for the rest of your life, but you must take Medicare along with that group plan. Otherwise, you will be penalized. And after that 7-month window of your initial election period, if you go to the doctors, I've actually unfortunately seen this, eventually it's going to show in the system that that individual should have had Medicare, and the system will have, struggle to pay claims. The insurance company will notice, hey, we have this individual that's under 20 employees. They should have took Medicare. We're not going to pay their claims. So it can cause much conflict. So for people that have small businesses that teeter on that 18 to 22 employees, that is probably one of the biggest questions you would ask your employer as you turn 65 is, where does this group fall? Are we under 20? Are we over 20? And that would be a very important question to establish before that 7-month window of being new to Medicare will close for you. So here is that card. Here is that Medicare card that we've been talking about. This is that special card that everybody worries, must I have it? Must I not? What does the card look like? And anybody that has aging parents or is taking care of their parents or family members or friends that is in Medicare, they will have a card that looks like this. This card is paper. This card has not really changed the way it looks in as long as I can remember. I've done this for almost 25 years. But the one thing that has changed since 2018 is it used to be that your social security number was on the card with the Part A and Part B effective dates, and then a signature. And then they realized after all these years that could be a real problem if somebody got a hold of that. That's all your identity. So in the last few years, the Medicare card has changed. Now you will have this number, random letters, random numbers that is on the card that's specifically pertaining to you with your Medicare Part A and Part B effective dates with your name, but no signature. Once again, the one thing that I thought they would change when they did start sending these new cards in 2018 is I thought they would go to a plastic card, but it is not plastic. It is definitely paper. So it's something that we got to take really good care of for the rest of your life. All right, so all this talk about the letters, what are all these letters? What do they mean? And so when I sit down with families, I try to make Medicare not so boring because it is a little dry. It's in most cases pretty straightforward and confusing and overwhelming, and people feel a lot of different emotions. It's funny because the other day I always have tissues on my desk, and my clients will say, you know, do people literally cry? Like, why do you have tissues in your office? And people actually get emotional because they're overwhelmed. Or nowadays, you know, I've had more people retire turning 65 than work past 65. It's just different times. So we definitely try to keep people on their toes and make things as exciting and not as overwhelming, but it's still pretty much cut and dry. So the parts of Medicare are the most important takeaway from today's presentation that we like to just make sure get across to anybody that's listening because of all the confusion out there. So Medicare Part A, I always tell clients, is basically your birthday gift. And that's the government saying, happy birthday. We recognize that you've paid into FICA basically your entire life, 10 years or 40 quarters. And now we are going to grant you, you are qualified for Part A for no extra cost, as long as you've paid in over that certain amount of time. And what Part A does is it covers anything inpatient hospital service. So inpatient hospital care is covered under A, skilled nursing facility is covered under A, home health care is covered under Part A, and hospice care. Anything that's happening in that in-network facility would be covered under Part A, 80%, which is not a bad thing. You know, for somebody that's turning 65 and they just start, you know, have the Medicare Part A in place and they did no insurance other than Part A, not a good idea just to do Part A alone, but you would at least have 80% coverage in a hospital setting. The Part B, oops, sorry guys, hold on one second. I'm going back. All right, here we go. All right, so the Part B, the other piece that we were talking about, this is the one that does come at a cost, which we'll get into in the further part of the presentation. Medicare Part B is the medical side of Medicare, covering 80% as well outside of the institution of the hospital. Part B is going to cover those primary doctors, those specialists, physical, speech therapies, observation, home health care, any kind of outpatient hospital service, anything that's happening outside of the institution of the hospital, and then durable medical equipment. Those are just some of the most important things that are covered under Part B. Once again, though, Part B is not free unless you have a low income or qualify for a subsidy. And Part B also, once again, is 80%. So for individuals that know nothing about Medicare and that Medicare card shows up in the mail and they have that card and they're looking at A and B, they are going to be given 80% medical expenses in the hospital and outside of the hospital before they even take insurance. Okay, but that's not including prescription Part D. So the Medicare Part B costs are here laid out for you. It used to be that everybody paid a certain amount for Medicare. Everybody paid the same amount. In 2006, that changed and it went on a sliding scale, which is in front of you, depending on what your income is. So if you file jointly or separately, when you apply for Medicare or are enrolled in Medicare, the government looks back 2 years at your modified adjusted gross income. Using this chart, you can see on that the red circle, the red square, the amount of that which you would make to what your Medicare premium would be. As of this morning, these are 2021 rates, and I have been waiting diligently for this presentation for the 2022 rates to come out. And of course, this afternoon, my assistant had sent you the rates, which we were not able to update in time for tonight. Those just came out today. We will send the rates to everyone once we get a hold of them and we're able to send to you folks. We will include it in the presentation. But right now, these are the rates for this year. From what I was able to look at a quick glance this afternoon is that these are all, each of these sections are going up about $10 for next year in 2022. Paying your Part B premium. So how do we pay something like this? How do we pay this Part B? There's only two ways to pay it. If you're somebody that chooses to take your Social Security or already is taking Social Security upon Medicare eligibility, they will take that Medicare premium that we just saw previous slide right out of your Social Security payment before you can even miss it. If you're not taking, if you decide to wait to take that Social Security income, then you will be billed quarterly every 3 months with a larger statement to pay that monthly or that monthly bill times 3 months. That is the one thing that I tell my clients, if you are going to do it quarterly, that is the one bill you do not want to forget to pay. If you don't pay it timely, they will cancel out your Medicare Part B premium. And there it is nearly impossible to fix that. And then you would have to wait till the next, remember that general enrollment period is signed back up, and then you'd be penalized. That's not to scare people. That's a fact. You know, we just want to make sure that when you pay it quarterly, that it does get paid. If you receive a low income subsidy through your state, I had mentioned this earlier, some people may qualify for, Medicaid or state extra help. There is help out there to pay that Medicare premium, that $148.50 or larger. All right. So this, I would say, is our most important slide. I think for people, especially that are right at that point where they're either 65 and still working or turning 65, this information on this slide is probably, I have found, the most important to really give the information about all your choices in Medicare. So we know that we talked about the A and the B, and we know now that A and B, they do cover 80% of somebody's medical expenses. And that's fabulous, but that's never usually enough. To leave somebody with just Medicare alone, it is definitely your choice. I tell my clients, I am never going to be the girl that tells you what to do, but I'm going to give you the information and the tools to make the best decision for you and your family. What knowledge we share with you is yours to make that decision, but that 20% left over, if you do nothing at all and you fell and broke your hip and you ended up in a hospital, that could be financially crippling. So we want to make sure that we give people the knowledge and the tools that they understand when they choose a plan. When they hear the term Medicare Advantage, they know what that is. If they hear the term Medicare Supplement, they know what that is. And anybody that's listening today that has gone through the experience of Medicare already with themselves or a spouse or a family member, when somebody is approaching 65, and especially right now, because we are in our annual enrollment period, this is the time where anybody in Medicare can make a change. The mail that people receive, the solicitation about choosing a plan, the TV commercials, I think every other one is about an insurance policy. And what I tell my clients is, I know the concern is always there. What am I going to take for insurance? What am I going to do when I retire? That is so important. But understanding what the plans mean and where they're different is more important than choosing the plan right away. And so we want to give people the tools to make all these right decisions and understand what a Medicare Advantage is, or understand what a Medicare supplement is, so you can make that well-informed decision about the insurance policy that makes the best sense for you. So we can sit in a room, and I literally could put 67 different plans in front of a family, because that is about how many there are. And every year I feel like there gets to be more, more companies, everybody wants in. But what I like to do is I like to break these plans. If we took all 67 right now and we put them on the table and we were going to separate them, we would separate them into two categories, which are right in front of you on the screen. And the two categories we're going to separate them into is the category Medicare Advantage or Part C. So we know we got the A, the B. I lightly mentioned D, but we also have C. Is there C? And there is. And that's another term for Medicare Advantage. So we got the A, the B, the C. And in Medicare Advantage, also includes the D in most plans. So what is a Medicare Advantage? And these are the ones, once again, that right now are hitting your mailbox, are on the TV and every other commercial. They're talking about all these different plans and all these benefits they can give you. But what does a Medicare Advantage truly mean is that even though somebody goes through the process of getting on Medicare Parts A and Part B, even though they're going to pay for it, we showed you that slide, you're going to pay for it. If you choose a Medicare Advantage, that plan becomes your primary. You still must have Medicare A and B to have it, but Medicare is going to sit on the back fence and is going to regulate the plan, make sure they're doing their job, make sure they're paying their claims safely and right. But the insurance company is going to be calling the shots and primarily taking care of you. So when we deal with Medicare Advantage, another term for that would be an HMO or a PPO or a POS. Back in the day, that's what they were called, but now we've made them a little bit more fancy and we call them Medicare Advantage. Medicare Advantage plans are very nice. They're very popular here in Western New York. One of the biggest reasons why Medicare Advantage plans are very popular is because the price point is usually perfect. You know, these plans have multiple different choices. They try to offer low premiums. You know, some of the premiums can get a little higher. You know, they can range between $0 a month, believe it or not, with drugs included, all the way up to $100 for some plans, or a little bit more. With a Medicare Advantage, though, that is a combination of your medical and prescription plan all rolled into one card. So if you have group insurance right now or a New York State exchange plan or any kind of plan, and you have one card that does everything, that's kind of what a Medicare Advantage is here, you know, where we live in nationally across the nation. Medicare Advantage is kind of a plan that's wrapped up one little card for everything. With a Medicare Advantage, though, you also get some extra benefits. You get, a lot of times, most of the plans give gym. They give eyeglasses. They give dental coverage. Now, dental, I tell people, don't get too crazy excited because it's usually very basic. Your 2 cleanings per year. You can sometimes add on a little dental depending on the company and the plan, but it's basic dental. Some are now giving, the big thing this year that we're seeing is a Medicare reimbursement. Some of our companies are giving $25 or $40 or $50 back into that Medicare check. So there's a lot of different features with Medicare Advantage that make them very popular. But when my clients come to me, we have to look at many things when they are looking at a Medicare Advantage, because when you have the plan primary and Medicare secondary, these plans work with different doctors and different hospitals. So if somebody comes to me and they say, I want to, you know, go to Roswell, we want to make sure that their doctors and their hospitals are in the plan. So with a Medicare Advantage or an HMO or PPO, they're more of a contracted plan. HMO stands for Health Maintenance Organization. So those are going to be the ones that you definitely want to go to a doctor in the network, because if you don't go to a doctor in the network, you're going to have an issue. It might not be covered. There's also PPOs that are a little bit more free. They stand for Participating Physician Organization, and they will allow people to go in and out of network. If you're in network, you pay a smaller copay. If you're out of network, you may pay a little bit more in copay or a percentage. And they can also be a little bit more well-traveled, a little bit more portable. So in the Medicare Advantage world, you know, when people come to me with a list of meds and a list of doctors, it's never, ever one size fits all. It's making sure that the choices people make are going to fit their needs. So Medicare Advantage are going to be wonderful for a lot of people, as long as we make sure that their doctors, hospitals, and meds are absolutely on the list. Okay, so Medicare Advantage plans, once again, are very popular. But some people look at me and they'll say, Tammy, you know what? I need a plan that's a little bit more national. I want to be able to go here and there and not worry about being in or out of network. Or Tammy, you know what? I see these Medicare Advantage plans, they look great, but boy, I go for an MRI a couple times a year. These copays are a little bit higher. Is there anything out there that might be a little bit less in copay or a little bit more traveled out of the area? And that would be, when I'm looking at the screen, the left side of my screen, where you'll see that original Medicare separation. So a plan where you see original Medicare first, another term for that type of plan that we can offer clients is a Medicare Supplement or a Medigap policy. There's two different terms for it, means the exact same thing. When somebody's looking at a Medicare Supplement, it's totally different. I always tell my clients, it's like comparing an apple to an orange. Very, very different. There's nothing the same about it. A lot of times people use the term Medicare Supplement for all plans. You know, you're choosing a plan, going on Medicare and I need a supplement. But that, when I hear that, and I want my clients to leave me understanding that when you talk about a supplement, that means that Medicare is your primary. Remember, Advantage plans, the Advantage plan is primary, Medicare second. When you hear of a Medigap or a Medicare Supplement, we want you to remember that Medicare is your primary. So with a Medicare Supplement, you go to the doctors, you go to the hospital, they're going to be billing Medicare first. And Medicare, remember, the A and the B covers 80% in the hospital or 80% out of the hospital. And then whatever's left over will go over to the supplement. And there's many different supplement companies to choose from. There's different letters. If you looked at a standardized program of a Medicare supplement in the Medicare and You handbook or online, you just type in Medicare supplement and you'll see like an A through an N type of plan, depending on your state. There's different plans. Pretty much all of them are standardized, but there's some different things depending on some states. But you'll see this chart and they all are going to follow Medicare being first. Whatever Medicare doesn't pick up, that supplement will normally pick up, with some plans 100% of what's left over. Other ones, a little bit of a copay. There usually is a beginning of the year Medicare deductible, which is not like, you know, some of these high deductible plans where you see $1,000. It's usually around $203 this year. Next year, we have not seen that yet. But right now it's $203 in the beginning of the year. With a Medicare supplement, national is a very big deal for clients. You know, if people are really looking to say, I need to be able to go to Cleveland Clinic. I don't want to worry about, you know, getting permission from my insurance company. I want to be able to make my appointment and go. Medicare supplement is a very nice policy for them. Okay. PPOs will still give you that too, but sometimes with a little bit more cost out of pocket. But a supplement, whether you're laying in a hospital bed in Buffalo or a Cleveland Clinic, the cost is going to be the same. I had 3 clients last week. It was very strange. They were all on the same day. And one of the last things they told me as we were going through the list of all their needs, one was literally walking out the door when I said, oh, I'll call you next week. And he says, you can't call me next week. I'll be in Cleveland Clinic for a procedure. I said, well, wait a minute. That changes everything, you know? So those fine details, you know, where people's lifestyle or people's medical choices being, maybe sometimes they go to Cleveland Clinic for their care. I know my son, we take him to a doctor in Boston, Massachusetts every quarter. We had to have a portable plan. Thank God we do. And sometimes that's very important to people's needs. So Medicare supplements will give a lot of freedom with that. No referrals needed. But with a Medicare supplement, your cost is going to be a lot more because you pay little to no copays on the medical side. So once again, it's educating you, understanding the difference is the most important thing. And then showing you these costs and showing you all the different products once we understand a little bit more about the client. The other thing about a supplement that's really important for people to know is that the drug plan, the Part D, is separate. So remember back when we talked about Advantage plans, that's an all-inclusive product, medical and prescriptions under one card. When we do a supplement or when somebody's interested in a supplement, there is, going into 2022, 19 different Part D drug plans we can offer somebody in New York State, and pretty much nationally, there's all different, you know, different states have different drug plans, but mostly it's about 19 in 2022. This year we had 27 choices, and next year it's condensed. Actually, this is the first coming year that we've seen it under 20 choices. Now, how do we determine, you know, when somebody wants a supplement, what Part D would be best for them? is we have special tools that we use to take a list of your meds, plug it into a specific site, and it'll bring back to us the different products that cover your meds with the cost, the copays, the deductibles. And that's how we help clients determine what would be the most appropriate drug plan for them. I would say in my career of doing this for a very long time, the Part D, the drug plans, people's prescriptions, a lot of times, 9 times out of 10, are steering the ship on what plans they're choosing. Prescriptions have gotten to be very, very expensive. It's very disheartening to me to see the cost of meds. You know, one of the biggest differences when we're doing evaluations, one of my favorite things to do with my career is work with people with group insurance. And when they're questioning, especially during COVID, what's been very enlightening to me is a lot of people think, I don't know if I can retire. I don't know if I can afford to retire, because they don't know. And then we take their group insurance and then we compare that to Medicare and we show them, you know, the differences. And it's really eye-opening. But one of the steady things that stays consistent when I've done this for clients in all different aspects, but specifically leaving group insurance and going into Medicare, is the cost of medications leaving group and going into Medicare can really go up quite a bit. It's very astounding for a lot of people that might have paid $20 for insulin. And now in Medicare, in their retired years, they might pay $40. So it's one of the biggest parts of my job, and probably where I take the most time is really researching and looking at people's prescriptions and making sure that we give them the most affordable option, or give them an idea, if they're looking to retire, the difference between group insurance and the Part D drug plans out there. Okay, so even though I kind of went over the Medigap policy, or Medicare Supplement, if you will, I do like this bullet point just to be up there for you folks, just as a reminder, because obviously it wasn't written down. I was speaking about the difference. But remember that Medicare Supplements, or Medigap, is a health insurance policy provided by private insurance companies. They use original Medicare only. So you must have Parts A and Part B in place in order to have a Medicare supplement. Medicare will always pay primary, and it will cover the major gaps in Medicare. You'll see at the bottom of that, in that bullet point, Medicare approved charges. So this is important, because if your doctor codes things not as medically necessary to what Medicare likes, it will not be covered. So the key is you've got to make sure, if you do a Medicare supplement, that they're coding it as Medicare approved charges. And that doesn't really ever cause a problem, but we always like people to know that whatever you're getting, you know, it has to be medically necessary in order for Medicare to approve it. And that's pretty much with the Advantage plans too, but it's a Medicare thing, especially with the Medicare supplements. All policies are standardized. So like I said, lots of companies, each policy will be identical from company to company, but the only difference is the monthly premiums may vary from company to company. So we can have 6 companies all offering the A through the N benefit, but they all offer different rates. And that is something that we definitely pay close attention to when people are looking at supplements. We really try to give them the most cost-effective plan. It's not that we love one company over another. We're just thinking ahead, because we don't want them to pay so much, but can get the same plan with a different company and it costs significantly less, because the benefits are identical, except for in the states of Massachusetts, Minnesota, and Wisconsin. There's some little bit differences with the plans they offer. Okay. Medicare Part C, going back to the Advantage plans, remember the HMOs or PPOs that are all inclusive. You know, just in a quick bullet point, covered services and Medicare Advantage plans. Medicare Advantage plans cover all Medicare services sponsored, once again, by private insurance companies. Medicare Advantage plans may also offer extra coverage. Examples of that would be the gym I talked about, eyeglasses, dental cleanings. The big thing this year that we're seeing every second on the TV is that Medicare reimbursement. Not usually the full reimbursement. That's usually if you're getting extra help like Medicare and Medicaid, but they are offering some reimbursement. There's also drug coverage in the Medicare Advantage plans. You cannot have a prescription drug plan with a Medicare Advantage and then a separate Part D. So remember how I said Medicare Advantage being all inclusive, and then the Medicare Supplements, they have a standalone Part D. So if you think you found this awesome Medicare Advantage, this is perfect for me. All my doctors participate. I like the benefits, but 2 of my meds aren't on the list. Tammy, I'm going to go out and I'm going to purchase this standalone drug plan because my drugs I checked are all on their list. You can't do that. If you're on a Medicare Advantage and then you try to take a standalone Part D drug plan, it will knock out your Medicare Advantage plan with the drug plan in it. Now, there is certain Medicare Advantage plans, they're called private fee-for-service, or there's a Medicare savings account plan that does allow you to do standalone Part Ds. But once again, they're not as popular as our local Medicare Advantage plans here. So we tell people be very cautious of that. As you do your research, if you try to navigate this on your own, and once again, you find this great Medicare Advantage plan, but 2 of your meds are on the list, and then you decide to do a standalone drug plan, you will be left, it will knock out that Medicare Advantage. You will be left with just a drug plan and original Medicare. Rules for Medicare Advantage plans. Medicare pays a fixed amount for your care each month to these companies offering the Medicare Advantage plans. And these companies, once again, even though Medicare is not your primary, they must follow Medicare's set rules. However, each Medicare Advantage plan can charge different copays, out-of-pocket costs. Most companies have different rules for how you get services. For example, you may need a referral with some plans to see a specialist, or you can only go to certain doctors, facilities, or suppliers that contract with your plan for non-emergency or non-urgent care needs. These rules can change each year. Now, granted, if you have an emergency and your plan might be out of network, I'm just going to throw a name out there with Kenmore Mercy. They're not going to turn you away because it's an emergency. But if you electively have a surgery and you can't go to that hospital, it's not in the network, then that's when you can have a difference. So that's why it says you want to make sure that you're always going, if it's for a non-urgent situation, you're always going to in-network providers. Okay, that's very, very important with Advantage. Closer look at Part D. So Part D, once again, I think we've established that some plans include it and some plans it's standalone. But the 2 most important concepts of the Part D, I find is, the formulary. And once again, each Part D, whether it's embedded in your plan or separate, has a list of drugs that the insurance plan will cover. Medicare provides guidelines about the type of drugs that will be covered, but not too specific on the drug. Each plan has its own formulary, and Medicare does have some excluded drugs that may be a part of an enhanced formulary. So with prescriptions, once again, in my world, that is the most important job for me when I work with clients, to make sure if they have prescriptions that are, insulin or inhalers, or there's just so many out there, there's injectables, biologics, that there is not going to be a point where that is not covered. That is so, so important, sometimes more important than the insurance piece for them, because that might be a lifeline. If they don't get their insulin, that's a real issue. So that is where we have to take a lot of time and make sure that not only that their plan covers their medical expenses, but also the drugs that they take are on the formulary. So just like I mentioned, for people that do not take Part B as in boy, when they need to take it, they can be penalized. For people that might say, hey, Tam, I had this today twice, I don't take any meds, I'm not going to worry about a drug plan. Okay. If you don't take a drug plan, though, you may owe a late enrollment penalty for a continuous amount of time after your initial election period. So basically, in a nutshell, what that means is if you retire and your group plan has ended and you no longer have credible prescription drug coverage, and you go 63 days either after you're new to Medicare or once you retire without an appropriate Part D drug plan, Medicare will penalize you 1% for every month that you do not have a Part D in place. So a lot of people get mad about that because they had never taken a drug in their life. But to be honest with you, we try to encourage people. I'll never tell anybody what to do, but we do encourage that they are knowledgeable about what can happen if they don't take one. Obviously, the penalty will never go away. So I had a gentleman, and just to give a good example of this gentleman was never really told the rules. I don't know if he worked with somebody or he just kind of did things on his own. And I got a call from his friend saying, can you help him? So the gentleman called me and he was real upset because he never took a drug in his life. And now all of a sudden he was diagnosed with something very serious. And he was now taking 5 very, very expensive medications and he couldn't figure out why they were so expensive. He had no medical coverage, no drug coverage. He just had Parts A and Part B of Medicare. We were in the month of July. So we were, in the middle of the year. And he said, I need a drug plan now. And I said, okay, how old are you? I'm 68. Do you have anything in place at all? Are you what's going on in your life? Like, do you have any insurance through group or any retirement? Like, explain. He said, no, I have nothing, just Medicare A and B. So unfortunately, I was the bearer of bad news. I said, okay, first and foremost, I can't sign you up for a drug plan because we're in the 6th month or the 6th or 7th month of the year. And I can't sign you up for one until annual enrollment, which starts in October 15th and runs till December 7th. And that drug plan won't start until January. The other thing is you will be penalized 1% for every month you haven't had a drug plan, which is a 36%. By the time we get you on one, it's going to be a 36%, penalty on the average premium, which is around $30. That's the average. That doesn't mean all premiums are that. It's the average. So he was very upset. Now, sometimes depending on where somebody lives, if there is a Medicare Advantage that is a 5-star plan, it's rated by the top of the line 5-star. Sometimes we can enroll an individual into that plan. But at this time, where we were and the year we were in, there was no 5-star here locally that I can enroll him in. So he was stuck and he was not a very happy camper. He was very upset. So, even though somebody might never take a prescription the rest of their lives, you just have to know that, if you don't take a drug plan when you're eligible or years go on and you don't elect to take one, you are penalized 1% for every month you don't have one. Okay. Medicare versus group. So we have a lot of people that still are working and I can't even tell you how many people this year I've helped retire or show the way about how to enroll in Medicare because they are just done. I've worked with so many different walks of life, a lot of teachers, a lot of nurses, a lot of doctors. And the one thing about Medicare versus individuals that worked past 65 or have group insurance, if you can control it, you want to start the journey early. You want to start the journey of approaching Medicare early. I tell people now, it used to be like 3 months before. You can't sign up for Medicare till 3 months before if you're in your initial election period. But if you're past 65 and you really want to kind of get a grasp on what to do and when to do it and how you do it, it's always great to start that journey about 4 to 6 months before you anticipate enrolling in Medicare. Contact me as soon as you are ready to retire or if you're thinking about retirement. So if you see it in the horizon, it's always a good time to just have that conversation. At that point, when we are working with individuals that are under current group insurance, we take it very serious, and we like to review all your personal needs, your situation, daily medications, doctors, etc. We compare the plans offered in Medicare within your state and county. We research your daily needs as well as expected premiums, copays, etc. Travel, portability for people that want to be snowbirds, etc. Those are all things that go into the research with individuals, and not just people with Medicare versus group, but people in general, people that anybody, even turning 65 now, that are retired. We do a complete Medicare review to allow you to plan better for your retirement and be better prepared for that transition financially. So just like a financial planner, which I am not, we really try on the Medicare side and the insurance side to just make sure people are prepared so that they can go to their financial planners and work with them and have a good understanding of how it'll all look for them once they are ready to take that next step. In some circumstances, when making decisions on choosing Medicare, that spouse that is younger than 65 will absolutely play a huge part in that Medicare decision. That is actually usually one of my questions, my first questions when working with people is, how old is the spouse? We always are looking into your group option, if it's COBRA for that spouse, and comparing also the New York State exchange plans is also a very good idea that we tell people. A lot of people sometimes discredit COBRA. Oh, it's going to be super expensive. I'm not going to look at it. And then they want to just jump into maybe, the New York State exchange option, which is sometimes the best plan for them. But we always say, take a look at both, compare both. You never know. You may be surprised. My agency will work to make sure we help you explore all your options so you can make the best, well-informed decision for your whole family. We are in what we call the Medicare Annual Enrollment Period right now, which is AEP. That is running as we speak. That's why I've got bags under my eyes, October 15th through December 7th. Anything that somebody does during this time frame that's been in Medicare will start January 1 of 2020. And then there's another one that opens up, which is called the Medicare Enrollment Period, Medicare Advantage Open Enrollment Period, which runs January 1 through March 31st. So if somebody says, you know what, I'm overwhelmed, it's in the fall, it's the holiday season, and they didn't pay attention to the changes in their plan, and then they roll into the new year, we usually can make another change for them as long as it's one Medicare Advantage plan going to another, or a Medicare Advantage plan going to a supplement during this time frame. There's certain people that can do that. And then just a couple frequently asked questions. Does Medicare cover, offer dental coverage? Medicare will not cover dental care that you need primarily for your health of the teeth. But like we mentioned earlier, some Medicare Advantage plans like Part C will offer basic dental coverage. If it's a medical issue, people have oral cancer, that is different. Then some of the plans will, obviously offer on the medical side, the dental coverage. Would a husband and wife be on a joint family plan, or are they considered to be on an individual plan once eligible for Medicare? A husband and wife must be separate, separate plans once enrolled in Medicare. There are no family plans for married couples in Medicare. So remember back to that Medicare card, when our first couple slides, everybody gets a Medicare number. Husbands and wives are going to be separate. And that's a good thing, because not every husband and wife has the same needs. They don't have to do the same plans. And so you will always be in Medicare on a separate plan. And then, is there any way to avoid, everybody talks about this donut hole, or if you've heard of the coverage gap, that's also for when people are looking into Medicare, some of the things that swirl around in my office are so worried about this donut hole. The government does give everybody a certain amount of money towards their medications in Medicare. This coming year, it's $4,430 towards their medications. And basically what that means in a nutshell is, if you picture yourself with a bank of money with $4,400 in it, and every time you fill your medication in Medicare, Your copay could be $40, but the retail cost, let's say it's $400. They're taking that $40 minus the $400 retail cost of the drug, so $360, let's say, every time you fill that drug out of that $4,400 pot. Some people may never get to it. They may never use that $4,400. And this is once again individual. But some people get to it quick. I have people sometimes get to it in a month. I have sometimes people get to it towards the end of the year, the middle of the year. What happens then? And that's where that donut hole or that coverage gap is talked about, is buzzed about. And in that donut hole, people then are responsible to pay 25% of the retail cost of the drug, at a negotiated rate with the pharmacy and your drug plan and all the little things that go into it. So some people are affected by that, but there is a lot of extra help out there for people that do qualify. And if you do qualify, then you would not, in some cases, not in all, but in some cases, you would not be responsible to pay anything in that donut hole. Or sometimes, people use, if they qualify, something called Epic, which is very popular, and it's a New York State thing. It's a blessing. So if you need extra help or extra coverage and you qualify for Epic, it's a state pharmaceutical assistance program that will also help people at different levels qualify to have extra help in the donut hole or the coverage gap. So that's a big thing for some people is Epic. And that is our basic seminar for this evening. Mike has included my contact information, my cell phone, my office number, which has an 800 number for out-of-towners, my fax and my email. And once again, if you text the word Medicare to this number, we will definitely get in touch with me, and then I will get in touch with you.
Yeah, so Tamme, I want to thank you. We have no questions right now. So
Okay.
I want to thank you for taking the time to explain all this. For everybody on the webinar here, we will send a recorded version out. And again, if you text the word Medicare to that number, we'll make sure that Tamme gets a hold of you. So until then, thanks everybody. This is Mike Hebron with Tamme, and have a great night.
Thank you. Have a great night. Thank you, everybody.